Welcome to module number 3 of the Real Relief Foundations Masterclass. In module number 3, we'll be talking about food sensitivities as well as the low FODMAP diet. So there's 7 sections to this module, and in section number 1 we're going to be talking about how food sensitivities could be affecting you. Then we'll talk about a low sugar diet for anxiety and depression and balancing your blood sugars. Talk about gluten intolerance and celiac disease. Then dairy and lactose intolerance. Then we'll move on and discuss the low FODMAP diet and the challenge test. Then we'll talk about managing food sensitivities and a way in which you won't end up on a very restrictive diet, because that is one of the challenges when considering food sensitivities. And finally, we'll talk about the aims for this module. So, how could food sensitivities be affecting you and be affecting the brain? Well, firstly, food sensitivities can have an impact on our gut health. And because of the impact on the gut health, it can cause nutritional deficiencies, vitamin and mineral imbalances. Because different foods can be inflammatory, it can increase inflammation of the brain, and as we've talked many times in this course, we don't want high inflammation in the body or the brain, because that can lead to poor mental health. Other food sensitivities that you could be experiencing are unbalanced blood sugars, and as we'll discuss in this module, unbalanced blood sugars can lead to adrenaline surges and the fight and flight response, and anxiety can be produced. Another way foods can affect the body is they can have an opioid-like effect. So opioids are like morphine, they're like drugs that we can get addicted to. So particular food proteins can be addictive and have addictive properties. Finally, different food sensitivities can lead to brain fog, they can lead to fatigue, and they can lead to aggressive behavior because of many of these mechanisms that we've just discussed. So here's a few questions to ask yourself that can highlight whether food sensitivities or adverse reactions to food could be affecting you. So do you have strong sugar cravings, and do you get hangry? You know what hangry is, don't you? We've talked about this before. You're not angry, you're actually hungry, okay? And this will be showing that you could have some unbalanced blood sugars. So I want you to consider learning about blood sugar imbalances, especially if you've got anxiety or panic attacks, or you're waking up first thing in the morning with a racing heart, or even if your energy levels are up and down throughout the day. Next, does celiac disease run in your family, and do you have digestive complaints? So celiac disease is an autoimmune condition of the gut, in which we'll be talking about in the gluten intolerance section. And if anyone else has celiac disease in your family, you're 10 times more likely to have celiac disease yourself, because it is a genetic condition. So if someone else in your family has got celiac, then you really need to rule that out for yourself. Okay. Did you have eczema, asthma, frequent chronic earaches, or colic, either as a child or still as an adult? Now, these symptoms could show that you're experiencing a dairy intolerance, and I want you to watch that module if you have those symptoms. Do you have bloating, nausea, burping, flatulence, diarrhea or constipation more than twice a week? If you said yes to that, then we need to look at gut health issues, and I want you to look into the low FODMAP diet, as it may be helpful for you. And finally, do you have brain fog, sinusitis, or frequent vaginal yeast infections? Again, this may identify that you have a gut problem, and that could be helped with the low FODMAP diet. Okay. So we've previously discussed the essential dietary keys for enhanced mental health, and we spoke about the first 4 in module number 2. But in this module, we're going to talk about the next 4. So balancing your blood sugars, going gluten-free, going dairy-free if necessary, and supporting your gut health. So these are the food sensitivities that we're discussing in this course: blood sugar imbalances, gluten intolerance, dairy, and the FODMAP foods. So let's move on and talk about blood sugar imbalances and whether a low sugar diet will be helpful for your anxiety and depression. So blood sugars is one of the most important factors when it comes to anxiety, and that's why it's one of the essential dietary keys for enhanced mental health, balancing your blood sugars. And there's 6 problems with sugar when it comes to mental health. So firstly, sugar is empty calories. It supplies empty calories, and it can actually lead to further nutritional deficiencies. It actually causes chromium deficiency. Okay, and chromium is actually an important mineral for balancing out your blood sugars. And another problem with sugar is that it can cause your glucose levels to spike and then to plummet. And what happens here is you can get energy changes throughout your day. So sometimes you can be okay, and other times you can feel very flat and and very, very fatigued and melancholic. Also, when the blood sugars drop after eating sugar, you can have an adrenaline release, and we'll talk about that later. But this adrenaline release is really important for anxiety and panic attacks, and it can be a reaction to what you've eaten. Another problem with sugar is it's very inflammatory. It can inflame the brain, and it feeds bad bacteria in the gut. So we want to reduce our sugar intake. Now let's just have a look at what the science says and if there's any evidence that sugar is bad for our mental health. Well, here's an observational study that showed that high sugar diets increase the risk of depression, and showed that those with the highest levels of sugar consumption were 23% more likely to be diagnosed with a mental disorder than those with the lowest sugar intake. And this research confirmed an adverse effect of sugar intake on long-term psychological health, and suggests that lower intake of sugar may be associated with better psychological health. I want to look at a study on high GI diets, but firstly let me tell you what GI means. This is the glycemic index, and it measures how quickly a food causes our blood sugar levels to rise. High glycemic index means that glucose is released into the bloodstream really fast, and this is usually in response to foods like raw sugar and processed foods and potatoes and rice and pasta. So lots of white foods that don't have much fiber in them. The low glycemic index means glucose is released into the bloodstream slowly and steadily, and this is what you want. And this is most vegetables and fruit and protein. So what you want when you eat, you want the fuel, the glucose from your food to be released into the bloodstream steadily and in a steady manner to give you energy in the long term, not just a big spike for the short term. So when it comes to a high GI diet, it actually has been shown to increase rates of depression and anxiety. Studies reveal that those with the highest GI score were 44% more likely to be diagnosed with depression and 52% more likely to be diagnosed with anxiety compared to those with the lowest GI score. Isn't that amazing? So just by changing the way that you eat and eating foods that release sugar into the bloodstream more slowly, you can actually improve your mental health. So let me talk about low blood sugars for a moment, or reactive hypoglycemia. So hypo means low and glycemia means in relation to glucose or sugar, and that's the glucose or blood sugar in the bloodstream. So reactive hypoglycemia is low blood sugar that occurs after a meal. It's often in reaction to what you've eaten. The thing is, the brain requires fuel in the form of glucose or sugar to function, and stable blood sugars leads to sustained energy levels and mood. So I just want to ask you, does your day feel like this? Does your energy levels go up and then they come down and they crash? Or is that the way that you feel about your anxiety as well? It goes up and down throughout the day. So if that's the case, or even if you've just got constant anxiety, or this could be panic attacks as well, that you have frequent panic attacks throughout the day. If you have problems with sustained energy or anxiety or panic, then you really need to think about reactive hypoglycemia. So here's the symptoms of reactive hypoglycemia. So I like to separate these into two different stages, and it shows what's actually happening at the physiological level in the body. So in stage 1, your blood glucose levels drop, you have low blood sugar, and the symptoms you can experience include despair, depression, fatigue, dizziness, blurred vision, difficulty in thinking, confusion, weakness, and being quite uncoordinated in your movements. So then with stage 2, the adrenaline and cortisol are released. It kicks in, and this triggers the body to increase the blood sugar levels, because the body and the brain don't want you to have very low blood sugar levels, because the brain needs this glucose for its fuel. So in response to low blood sugars, the body will release this adrenaline so that the blood sugars will rise. And some of the symptoms that you can have in reaction to the adrenaline and cortisol release are palpitations, sweating, anxiety, anger, tremor, shaking, mood swings, and crying spells. So if you look at those symptoms, a lot of those sound a lot like anxiety, right? The palpitations and the sweating and the tremor. Okay, it's possible that your anxiety and your panic attacks are actually an adrenaline release in response to low blood sugars. Now, when you are thinking about low blood sugars and whether this is triggering anxiety, so you can actually look for some low blood sugar warning signs, and these could be cues for you to eat food very quickly to try to bring up your blood sugar levels. So you could yawn, you could be forgetting your words, so you could be saying your sentences and then forgetting your words in the middle of your sentence. That's quite a common one. So your thinking could be slowing down, and you could have foggy brain. Now, I remember one of my clients that she came in, and the first hour went really well in the consult, and she was talking and engaging, and then I could start to see how her thinking was starting to slow down. She was taking a lot longer to answer questions, and she was slower in her replies. Then she started shaking, and she said to me, "Oh, this is what happens before my panic attacks." And I said, "It's not a panic attack, it's reactive hypoglycemia. You're having low blood sugars, and your body is reacting by releasing adrenaline." And so right there on the spot in my consulting room, I ran and got some food for her, and we stopped that panic attack coming on board, and that that interaction was a life changer for her. By realizing her blood sugars were dropping, and that was the trigger for her panic attacks, we were able to stop them through dietary changes. Okay, so here's a few more questions to ask yourself. Do you have anxiety or panic attacks? These are a few questions to suggest whether you need to look into reactive hypoglycemia more and think about modifying your diet and taking some supplements to balance your blood sugars. Does your mood fluctuate throughout the day? Do you skip breakfast? So when you're skipping meals, you can say that's not technically reactive hypoglycemia, because reactive hypoglycemia is usually in response to what you're eating, and often in response to a poor food choice. But for some people, they've skipped their meal, skipped their breakfast, and their blood sugars drop because they haven't eaten, and that's when the adrenaline kicks in. Do you have a sweet tooth, and do you get hangry? Okay, so there's a couple more signs that hypoglycemia might be a key for you, because if you've got a sweet tooth and you're giving into it, what you're eating and the sugar that you're eating could be triggering the adrenaline release. Do you get hangry? So again, do you get angry because you're hungry? Do you wake up anxious? So if you do wake up anxious, ask yourself, what did I eat the night before? Did you eat something sugary, or did you have cake, or did you have chocolate or wine at night time? By eating something sugary before you go to bed, you might be creating some blood sugar imbalances overnight, and therefore you wake up with anxiety from that adrenaline rush. So does this sound like you? For years I skipped meals when I was too busy or anxious. On weekends, I often wouldn't eat until 10 or 11 a.m. and sometimes not even till 3 or 4 p.m. At work, I often skipped lunch, and when I did finally eat, it was always a sugary snack. Sometimes I was just saving my appetite for a nice meal out, or I was forced to wait for slow dinner service. This resulted in headaches, a breathless, hollow, almost crampy feeling in my stomach, a tight chest, adrenaline rush, anxiety, and I always had a panic attack when going out for dinner. Oddly, I always put these symptoms down to stress, or work, or relationships, and never hunger. I've only recently discovered that what I thought was a panic attack was actually a reactive hypoglycemic episode. So hopefully by hearing her story, you can see yourself in that story, and maybe some of the mistakes that you're making that could be having an effect on your mood stability. So I just want to show you in this graph for a moment what's actually happening with adrenaline and your blood sugars. Okay, so this is a graph where you've got blood sugars along the y-axis, and then with time. And so when with the green arrow, the turquoise arrow, this is when you eat food, and in response to eating food, your blood sugars will rise. At some stage, your body will be thinking, oh, I don't want to get my blood sugars too high, because high blood sugars are not good for the body either. So it releases insulin, and your blood sugar levels drop in response to this. Okay, and then throughout time, with where the red arrow is, your blood sugar levels stabilize. Now, this is what happens in a normal individual who can balance out their blood sugars. Now, let's have a look at what happens in reactive hypoglycemia. Okay, so we're looking at the pink line. So you eat something, and this is the first arrow, and in response to that, your blood sugars rise. But often with people with reactive hypoglycemia, their blood sugars rise too fast and too high. Then the body kicks in the insulin to lower those blood sugar levels. And then, unfortunately, with people with reactive hypoglycemia, usually the response is too strong, and their blood sugars drop too low and too fast. And this is when you'll get the start of the symptoms. Okay, so This is when you may feel the lethargy, the foggy brain, and the confused thinking. So this is when your blood sugars are getting too low. And then as they continue to get too low, the body then releases adrenaline to raise those blood sugar levels. And this is when the anxiety and the panic attacks and the sweating and the heart palpitations can occur. So hopefully by seeing that illustration, you'll start to understand why this happens and how this happens. Now let me say that eating sugar does not help your low blood sugars, okay? Because a lot of people think, oh, I've got low blood sugars, I must eat some sugar. No, you've got to fuel your body, and you could give your body some carbohydrates, but some carbohydrates that release blood glucose into the bloodstream slowly. So what does eating sugar do? It does not help low blood sugars. It actually brings sugar into the bloodstream up high quickly, so it goes straight up, and then your body reacts by dropping your blood sugars quickly. That's what we've seen in the chart that I've just shown you. And then the body releases adrenaline, which can lead to anxiety and panic attacks. So eating sugar is the wrong thing to do. It's the complete opposite of what you need to be doing. And we'll talk about foods shortly. But basically, in the module number 2, in which I showed you to have protein and fats and vegetables in every meal, that will help stabilize your blood sugars. So what are the causes of reactive hypoglycemia? So firstly, sugary and processed diet, okay, foods in your diet. So those sugars are released into your bloodstream quickly, and it results in your blood glucose levels going up too quickly. But also, if you're eating food that is low in protein and low in fat, that can also be a cause for your blood sugars to rise quickly, because fat and protein stabilize those blood sugars. Also, skipping foods is another cause. Chromium and alpha lipoic acid deficiency are another reason that you can have reactive hypoglycemia. Adrenal fatigue, and also mitochondrial dysfunction, which I'll speak about in a moment. Lastly, if you've had any type of gastric surgery, this is another cause of reactive hypoglycemia, because it can result in something called gastric dumping. So it means that the food that you're consuming is dumped or released into your bloodstream far too quickly, and this can lead to blood sugar levels rising. So how do you control reactive hypoglycemia? Well, here's a few tips for you. So firstly, avoid and limit sugary foods. So this is probably the top priority. So stop eating biscuits, cakes, lollies, chocolate, alcohol, fruit juice, wine and soda. And especially stop eating these on an empty stomach. So you may be able to get away with eating a little bit after a full meal, but it's most likely that if you try to have something for breakfast, something sugary, some maple syrup on French toast or crepes or something, that it will really set you off. So yes, avoid and limit sugary foods. Also remove refined carbohydrates from your diet, and that includes white flour, white bread, white rice crackers, because they don't contain any fiber or nuts and seeds or anything to help stabilize or slow down the release of the glucose into the bloodstream. And include protein and healthy fats in each meal. So what I suggested in module number 2 and having the plate planner, that is a great way for stabilizing your blood sugars, including the healthy fats and protein with every meal, because these help stabilize the speed at which glucose is released into the bloodstream. Also include a healthy protein for breakfast. So that might include eggs or a protein smoothie. And this just starts the day off right, because if you start the day off wrong, then your blood sugar is going to go up and down. You might feel more anxious, you might not be able to eat. So starting the day off well as much as you can. Even if you feel very anxious, try to eat something first thing when you wake up in the morning. Even if it's just a banana, ideally it would have some protein in it as well, but just make sure that you eat something and good quality food. Don't skip meals, because skipping meals can lead to low blood sugars and then the adrenaline release. Also, eat frequently. I had one client that even when she was eating 4 times a day, it wasn't enough for her. It was too long between eating. So you may need to eat up to 5 or 6 small meals per day to help really stabilize your blood sugars. So for some people it's about changing what you're eating. For other people it's about how often you're eating. Another trick for you is to add an alarm on your phone to remind you to eat. I know it's not easy eating 5 or 6 times a day, and I don't recommend it to everybody, but there are particular clients that just do so much better if they eat something small. It could just be a date bar or a date ball, or some nuts and some seeds or some hummus and vegetables, but eating regularly can be really key. So adding an alarm to your phone to remind you is really helpful. So, and also remember to eat at the first signs of anxiety or any of the other warning signs, such as yawning or shaking or forgetting your words in the middle of the sentence. Okay, so I just want to define what sugar is, because we're talking about make sure you get sugar out of your diet. So what is sugar? So here are some examples of some hidden sugar. So white sugar, brown sugar, invert sugar, malt sugar, cane sugar. They're kind of easy to know what they are because they say sugar. But things like corn sweetener and corn syrup and high fructose corn syrup is also hidden sugar. Fruit juice concentrates, molasses, and sugar molecules ending in O's such as dextrose and fructose and glucose and lactose and maltose and sucrose, they're all sugars too. So if I recommend keeping processed food to a minimum, but if you are purchasing things in packets, check out the ingredients and make sure that you recognize everything that is in that packet. So here are some foods, sugary foods that you need to avoid. So when they do studies and they look at what sugary foods people are consuming, 44% of the sugar that we're consuming actually comes from what we drink. And that can be sodas and energy drinks and sports drinks, even electrolytes, fruit drinks, iced coffee and flavored water. So 44% of all sugar could be avoided if we just drank water, really. Plain water, not flavored water. 18% of the sugar that we're consuming across the population is cakes, pies, donuts, ice cream, chocolate and sweets. And other ways that you can be unknowingly consuming sugar is in the form of sauces like tomato sauce and barbecue and sweet chili sauce. Okay. Also, low-fat yogurt has added sugar, and many breakfast cereals and cereal bars will also have sugar in them too. So here's some natural sweetener options for you. I don't use a lot of these, and really you want to readjust your palate so you don't have to have sugary foods all the time. But if you do need a little bit of sweetener, you could use stevia, which is a very good one, and then dates, coconut sugar, raw honey and real maple syrup. So realize that they do contain sugar, and even though they're natural, they still could have an effect on the reactive hypoglycemia and cause a drop in your blood sugar and the adrenaline rush. So avoid these if you can, but just use them sparingly. There are a couple of other sugars that you can use called xylitol and erythritol, and these are low carbohydrate sweetener alternatives, and they're often used in the keto diets. So they are an option, but be aware that they can upset your stomach. So some people are sensitive to them. So I just wanted to give you some healthy sweet treat options, because I know for some people you'll have a sugar craving or a sweet tooth and you won't know how to fill it. So here's a few options for you. So fresh or frozen fruit, unsweetened Greek yogurt, date balls or or even just dates on their own, smoothies. You can make these nice and tasty and sweet with peanut butter or berries. Apple or banana with nut butter. So you're getting that fruit, but then you're getting that fat and that protein, which helps stabilize your blood sugars. Chia puddings are also another great idea, and you can sweeten them with fruit. Avocado chocolate mousse and dark chocolate are two other ideas. And as I said previously, be careful of the dark chocolate from the perspective of caffeine. So only eat that if you don't have a problem with anxiety and poor sleep. So I know many of you will be saying, oh Janelle, I would love to give up the sugar, but I really have such strong sugar cravings. What can I do? Well, the problem is sugar can be addictive, can't it? It activates the brain's reward system and dopamine is released. But the thing is, there are things you can do for sugar cravings. So even just restricting your sugar and refined carbs for 3 months can take away some of those carbohydrate, those sugar cravings. But also chromium supplements are a great one for anyone that craves sugar, and if you're overweight too. So supplements we'll talk about chromium in a moment actually. Also think about poor gut health. The fact is that sometimes those bad bacteria, those opportunistic bacteria, live on sugar. They love that sugar. So it's not actually you craving the sugar, it's these bad bacteria in your gut that's craving it, and they're asking you to get it for you. So treat your poor gut health, and we'll be talking about that in the next module. Also, finally, rule out iron and B vitamin deficiencies and mitochondrial dysfunction. Just from my observation, when you're running on empty, because you've got an iron deficiency or a B vitamin deficiency, or your mitochondria, which are the battery packs of every cell in your body, if you're running on empty, you can really crave those foods that give you that short-term lift, and foods that give you that sugar high very quickly. Okay, so by treating deficiencies, you can ease these sugar cravings too. So if you've modified your diet, you're eating protein and fat with every meal, and you're eating frequently throughout the day, so 5 or 6 meals a day, and you're still having problems with reactive hypoglycemia, then I recommend that you consider a couple of supplements, and they include alpha lipoic acid and chromium picolinate. So the dosage for alpha lipoic acid is 600 milligrams per day, and chromium picolinate is at 600 to 1000 micrograms per day. So chromium is great for anyone with sugar cravings, for anyone that's overweight or has insulin resistance. Now, chromium picolinate is the usual form that I recommend, but chromium polynicotinate is also another good option. Another option for helping stabilize your blood sugars is adding a teaspoon of cinnamon to your food throughout the day. Now, another helpful hint for those with difficult blood sugars is to support your mitochondrial health. So the mitochondria are the battery packs that you find in every cell of your body. You should have at least 200 of these mitochondria in every cell. And if they're not functioning properly, or you've got limited numbers of mitochondria, then you're going to feel very fatigued. You may have a lot of muscle pain and a lot of muscle aches. And I'm finding that a lot of people with anxiety and panic attacks have low mitochondrial function too. And what I'm observing is when their blood sugars drop too low, those with poor mitochondrial function are more sensitive to anxiety. It's like they're already running on empty because of their poor mitochondrial function, and so when their blood sugars drop and they're not getting that fuel into their body constantly, then their body's like, I can't give you any more fuel, but I can give you adrenaline, and therefore that's when the anxiety and the panic attacks come in. So I've found this strategy very helpful for a lot of people with anxiety. And the dosages that I recommend for mitochondrial support are CoQ10, 100 to 200 milligrams 2 to 3 times per day. So yes, it is quite a high dose, but it is really great for anyone with fatigue and anxiety. PQQ is another great mitochondrial support. It's a lot of people haven't heard of PQQ, they've heard of CoQ10, but PQQ can be a game changer. So the dosages on this are 10 to 20 milligrams once to twice daily. They're best taken at breakfast or lunch because obviously they're giving you energy, and if you have too much energy at night, it can affect your sleep. So I just wanted to make a note about intermittent fasting, because a lot of people hear that it's great for balancing blood sugars, right? Yes, well, I think that it's probably good for someone with insulin resistance, those that are overweight, but it isn't good for anyone with reactive hypoglycemia, because in intermittent fasting, you're usually going about 16 hours a day without food. So if you are very sensitive to your blood sugars dropping, you're going to have those adrenaline rushes coming on board. So in short, I do not recommend intermittent fasting if you have anxiety. So next we're going to talk about gluten intolerance and celiac disease. So let's now talk about gluten intolerance and celiac disease. Please realize that this section is very applicable to the next module on supporting gut health. And I will be referring back to this module when we're in the gut health module. So what is gluten? Gluten is a family of proteins found in grains like wheat, rice, spelt and barley. And gluten can be a problem in two different ways. Firstly, celiac disease, which we'll talk about in a moment, and also gluten intolerance. I'll also be answering the question, should everyone be gluten-free, later on in this section. So let's talk about celiac disease. So celiac is disease is an immune-based reaction to dietary gluten. So you have an immune response in response to the gluten that you're eating. It's an autoimmune disorder that primarily affects the small intestines, but can also have systemic effects, and it can affect your skin, it can affect your brain and therefore your mood, but also things like fertility. Celiac disease only occurs in genetically predisposed individuals, so you have to have the particular gene for celiac to actually have the condition celiac. The most recent estimates for celiac disease is 1% of the population, but if you have a first degree relative, that risk is increased by 10 to 20 times. So therefore it's most likely that between 10 to 20% of people with a first degree relative with celiac actually has celiac disease themselves. So I did ask you the question right at the beginning of this module, didn't I, whether you had a blood relative with celiac disease. So if you do, pay particular attention to this section. It's also known that 4 out of 5 people with celiac disease have actually go undiagnosed. So that's one of the reasons why I always ask my clients to be tested for celiac disease, because most people go undetected and have a lot of sort of mild or subtle symptoms of celiac disease, which we'll talk about in a moment. It's also been suggested in the scientific literature that doctors should be paying a lot more attention to celiac disease. This is what was said. And it says physicians need to be readily receptive to including celiac disease in their differential diagnosis of patients. Physicians should especially be sensitive to those patients who have the non-specific complaints of arthralgia, which is joint pain, myalgia, which is muscle pain, and fatigue, because celiac disease can easily remain undiagnosed in these individuals. So again, if you have any of these symptoms, joint pain, muscle pain or fatigue, then you should be getting your doctor to do your celiac testing, which I have already recommended. So what are the symptoms of celiac disease? Well, firstly, you have the classical celiac disease symptoms, which include diarrhea, constipation, abdominal pain, poor appetite, bloating, anemia, either low iron or low vitamin B12, also failure to thrive. So as you'll note that most of these symptoms are related to gastrointestinal symptoms or malabsorption. So the anemia and also the failure to thrive, meaning you might not grow as fast as other children, or you may be quite skinny. They are actually symptoms of celiac disease, and this is because of the effect that the autoimmune condition has on the gastrointestinal tract. It means that the gut is not as good at absorbing the nutrients that it should be. Now there's another set of symptoms for celiac disease that often go overlooked, and these are referred to silent celiac disease. I often like to call it subtle celiac because it's not that you don't have any symptoms for celiac disease, it's just that these symptoms are not the symptoms that correspond to the gut health issue. So with silent or subtle celiac, you can have few or no gastrointestinal tract symptoms. So you may not have constipation, you may not have diarrhea, you may have no tummy pain at all, but there'll be other symptoms that you have. And interestingly enough, these symptoms here that I'm going to discuss in a moment are the most common presentation for celiac. And that's the reason why 4 out of 5 people with celiac disease go undiagnosed with it. So what are these silent or subtle celiac disease symptoms? They include fatigue, they include depression, infertility, heavy periods, muscle and joint pain, autoimmune conditions, mouth ulcers, dermatitis and headaches. So if you've got any of these symptoms and you don't have any gut issues, you still want to rule out celiac disease. So there are a few different ways to detect celiac disease. The first one that is really like a screening tool is the blood test, and that's what I've recommended for you. It really does only pick up about 80% of cases of celiac disease, so it is imperfect, but it really is the only way forward. With the blood test, you're really looking for an elevated level of tissue transglutaminase antibodies, or TTG IgA antibodies, or deaminated gliadin peptide IgG. So they're the tests that I've recommended for you and that your doctor or laboratory would have got done for you. So if you have an elevated level in the blood test, then your doctor will go on and refer you to have a small bowel biopsy. Now this is really the gold standard for detecting celiac disease. So they look at your small bowel and the intestinal lining and see how much damage you have to that lining, and see if your microvilli are intact or not. Now another way that you can sort of look for celiac disease is to see whether you have the genes responsible for celiac disease. So you can do genetic testing. Now the genetic testing doesn't tell you if you have celiac disease, but it tells you whether you have the propensity for it or not. So I have recommended that you get the celiac disease tests done, and what you're wanting to look for is to see whether you have elevated antibodies for TTG, IgA antibodies, or the deaminated gliadin peptide. So make sure you take a look at your result. So if your celiac blood tests are elevated, see your medical doctor to organise a biopsy of the upper gastrointestinal tract. They know what they're doing when it comes to this department. It's just really getting those blood tests in the first place which are the challenge, or getting your doctor to actually have a bit of an open mind to what might be causing your depression or fatigue. So if you detect that you do have celiac disease, how do you treat it? Well, basically you have to go on a gluten-free diet, and it has to be very strict. Like, you don't even want to be using a toaster which normal bread is used in. You don't want to have any traces at all of gluten in your diet. Grains that contain gluten are wheat, barley, couscous, malt, rye and spelt. So you want to avoid all of these grains. You need to also rule out nutritional deficiencies due to poor digestion and poor absorption, because when you have celiac disease, and because it's an autoimmune condition, the immune system has attacked the lining of your gastrointestinal tract, so it's not going to work as well as it should, and therefore you may have these deficiencies. Okay, so remember, in module number 5 we will be talking about vitamin D and iron and B12 and folate as well, so make sure that you get your blood test done if you haven't already, and review your results. So going off gluten is going to help heal the lining of your stomach, but if you're an adult and you've had celiac disease your whole life, it's most likely that you may need some extra support to heal the intestinal lining. And so I suggest that you take a lot of notice of the section in the gut health module on healing the intestinal lining and following those recommendations. And also, anyone with celiac disease should contact the Celiac Disease Society in your country, because they are going to be able to help you with all the tricks when it comes to eating out and reading food labels, and making sure that your food isn't contaminated with gluten. So I'm going to move on now and discuss the question, should you eat gluten-free? Okay, and basically here's my guidelines. If you have a positive result on the celiac disease test, then you definitely need to avoid gluten your whole life, and you need to do that very, very strictly. Okay, if you have depression, anxiety, muscle pain or an autoimmune condition, then yes, it's highly recommended that you go gluten-free. And you don't just have to take my advice. Here is a quote from the Frontiers in Human Neurosciences. It's a scientific journal, and they've said a grain-free or gluten-free diet could improve the mental health of many and be a complete cure for others. Isn't that amazing? They're saying that your mental health, or if you have a mental illness, that could be completely cured by going gluten-free. And here's some more information that they share. They say we present the implications for the psychological science of the findings that in all of us, gluten makes the gut more permeable and can thus encourage the migration of food particles to sites where they are not expected, prompting the immune system to attack both these particles and brain-relevant substances that resemble them. And they also release opioid-like compounds capable of causing mental derangement if they make it to the brain. Now, I know that statement is quite scientific and it's got a lot of jargon in there. So let me just simplify for you what the problem with gluten is. Well, firstly, gluten cannot be broken down by the body. We don't actually have any enzymes that can break it down. And the gluten molecule itself is problematic. Firstly, it increases gut permeability. And in the gut health module, we'll be talking a little bit about leaky gut. So gluten increases leaky gut and can cause leaky gut. The gluten molecule also stimulates the immune system and is very inflammatory to the brain. And we've heard throughout this course already that depression and anxiety and other mental health concerns can actually be caused by high inflammation in the brain. So gluten is one of those factors that can increase inflammation in the brain. When you look at the structure of the gluten molecule itself, it actually has opioid-like properties. And so that means that gluten can be very addictive, and it can also just create behavioral change in some people. So here's my suggestion when it comes to avoiding gluten. So if you're diagnosed with celiac disease, please see your Celiac Disease Society in your country and they will give you a lot of support. Here's some foods that are naturally gluten-free. So fresh fruit and vegetables, rice, potato, corn, plain meat, not sausages because they might have some wheat or grains added. Fish, eggs, cheese, milk, most yogurts, pulses like beans and lentils, and fats and oils. You will also need to check the ingredient list of all processed foods to see whether they contain gluten. So in module 2 we talked about our plate planner, and if you follow my recommendations there, that will naturally provide you with a gluten-free diet. So the grains and starches which contain gluten are wheat, wheat germ, rye, barley, bulgur, couscous, semolina, spelt, and triticale. Couscous, semolina, spelt, and triticale. So hopefully so you can see why I've included being gluten-free as one of my dietary essential. So you can see why going gluten-free is so important for anyone that wants to improve their mental health, and that's why I've included it in one of the 8 essential keys for optimizing your diet for enhanced mental health. So next we'll be going on to discuss dairy and lactose intolerance. So let's now talk about dairy and lactose intolerance. So as I've previously noted, going dairy-free is one of the 8 essential keys for enhanced mental health. But I've always just said you only need to go dairy-free if absolutely necessary. And in this section, I'm going to be talking to you about sort of my guidelines and the guidelines that I use with my clients to whether they should be dairy-free or not. So to get on the same page, let's discuss what dairy products actually are. They are foods made from cow's milk. Okay, and they include milk, butter, cheese, yogurt, ice cream, whey, casein and lactose, cream including heavy cream or sour cream, and also other milk-based protein powders. So what's the problem with dairy? Well, firstly you have to realize there's 2 components in dairy that can cause a problem. Firstly, lactose, which is the sugar molecule found in dairy, and also casein, which is the main protein found in dairy. And in general, the problems that dairy have on the body is that it's inflammatory, so it can inflame the brain and also sort of turn on the immune system. It also has opioid-like properties, and so can be very addictive and also cause different changes to behavior. Dairy is also mucus forming and hard to digest, and so this can put a lot of strain on the digestive tract. So here are a few symptoms of dairy intolerance. Firstly, you've got the digestive symptoms such as bloating and belching, flatulence after meals, also tummy discomfort and pain, nausea, indigestion, reflux and diarrhea. But dairy intolerance doesn't just show as digestive problems, but also systemic immune problems also. So if you have problems with sinusitis or asthma, postnasal drip or eczema, it could be due to a dairy intolerance. And anyone that had chronic earaches or tonsillitis or dairy intolerance as a child, I want to suggest that you also might have problems with dairy now, and it's just that the symptoms of your dairy intolerance has changed. So rather than having the earaches and tonsillitis or gut problems, it might change to hormonal issues. And so it's possible that if you have polycystic ovarian syndrome or PCOS, or premenstrual syndrome or PMS, or even heavy periods, that could actually be due to a dairy intolerance. So let's talk about lactose for a moment. So lactose, as I said, is the sugar molecule found in dairy products. And our body makes an enzyme called lactase, and it makes it in our small intestines, and it helps break down that lactose. So if someone has lactose intolerance, they do not produce enough of the lactase enzyme. And lactose intolerance symptoms usually include the abdominal cramps and pain, nausea, bloating, gas and diarrhea, and symptoms start 30 minutes to 2 hours after consumption. So when we look back at the symptoms of a dairy intolerance, lactose intolerance is really going to show up more in that digestive symptoms area. Okay? So there's two major causes for lactose intolerance. Firstly, genetic variations. So you may have a genetic weakness in the MCM6 gene, and this can lead to lactose intolerance. Now, of interest is that these lactose intolerance genes are actually higher in people from South America, Africa and Asia. So if you live in those countries, or if you have ancestry from those countries, it may be that you have a genetic intolerance to lactose. And you can see on the map of the world there, those countries that are much darker, they have higher rates of lactose intolerance from a genetic standpoint. There's another reason that you can have lactose intolerance, and that's usually a secondary problem, and it's usually due to the damage of the lining of the intestines. So you may have celiac disease, and because of the damage to your intestinal lining, it means that your body's not making the lactase enzyme. This can occur in Crohn's disease as well as other GI inflammatory conditions. Now, to diagnose lactose intolerance, there's three different ways really. Firstly, you can get your genetic testing done, and you can find out whether you have that genetic weakness that means you don't make the lactase enzyme. Secondly, and this is really the gold standard, is just the elimination diet. You eliminate dairy or you eliminate lactose, and you see if your symptoms stop. Okay, and finally there's a hydrogen breath test that can also be used to diagnose lactose intolerance. So let's now talk about casein, and as I said, it's one of the main proteins found in dairy products, and over 80% of total protein in milk is in the form of casein. The other main protein in dairy is the whey protein. But casein, when it's digested, it actually produces a casomorphin molecule, and this has the opioid-like activity which can target the brain. Casein is slowly digested and may put a strain on the digestive tract. It increases mucus production and it increases inflammation. Now, if we go back to the symptoms of a dairy intolerance, and you have a lot of the symptoms in the systemic and immune areas like asthma and eczema, and possibly the hormonal symptoms as well, is most likely that you are affected by casein. Okay, so coming back to the question, should you avoid dairy products? Because when I've said it's one of the 8 essentials for mental health, one of the 8 dietary essential keys for enhanced mental health, I've said avoid dairy if necessary. So here's my guidelines for whether you should avoid dairy or not. So if you have severe depression and fatigue, I think it's good to avoid dairy. If you show current symptoms that we've just discussed, or you have a history of dairy intolerance as a child, I strongly recommend that you avoid all dairy. And also, if you don't mind a more restrictive diet. So the thing is, I find recommending a gluten-free diet is, as I said, I want everybody to do a gluten-free diet if you have poor mental health. But for some people, going dairy-free and gluten-free is quite restrictive, and they struggle with that. So I'm about finding dietary guidelines that people can follow for the long term, that is not too restrictive for them. Yes, it's ideal to go off dairy and gluten, but if that's too restrictive for you, then just go gluten free. But as I said, if you do have those strong history of dairy intolerance symptoms like eczema and asthma, and dairy tolerance as a child like chronic ear infections and tonsillitis, then I highly recommend you go off dairy. So also go lactose free if you've been diagnosed with lactose intolerance, and if you have the MC-M6 genetic variation, that means that you don't make the lactase enzyme as an adult. So my general rule is that I usually recommend a gluten-free diet for everyone with poor mental health, and also dairy-free if they show current symptoms or a history of dairy intolerance. So I wanted to give you a few dairy alternatives. So if you can't drink dairy products, then here's some good options for you. So some milk alternatives include rice milk, oat milk, almond milk, coconut milk and cashew milk. Some butter alternatives are coconut oil, mashed avocado or olive oil. Some cheese alternatives are cashew nut cheese or goat's cheese. And some ice cream alternatives are sorbets, coconut or oat-based ice creams, or even just mulling up some frozen bananas and berries. There are a lot of lactose-free products out there now on the market, so you can get your hands on these. So rather than going completely dairy-free, you can buy lactose-free milk and lactose-free yogurt or kefir. Now also realize that you can actually make your own lactose-free milk, and you can just purchase lactase drops, and you add the lactase drops to the normal milk to break down the lactose, and you leave it for some time as directed on the drops to let the lactase enzyme break down those lactose. You can also take lactase capsules and lactase enzymes as a capsule, and this is great for if you're out and you're trying to really avoid lactase, but you may eat something and realize afterwards that it had some dairy products in it, or it had some lactase in it, and then you can take the lactase capsules afterwards to help process that and help really reduce your symptoms. So this is a really good option, not to take every day with your food, just so that you can eat dairy, but more as a backstop, just an option for when you're out and about or going out to other people's place for dinner and can't control the lactase in your food so well. So I know that when we discuss a dairy-free diet, a lot of people are concerned that they're not going to get enough calcium. So I thought I'd include this information here. And please realize that with the free bonus, the Real Relief Real Food Planner, we have a list of calcium-rich foods in there as well. So make sure that you use that resource. So for calcium, the recommended daily allowance for an adult is between 1,000 and 1,200 milligrams per day. With 1 cup of milk, you will be consuming 300 milligrams of calcium, and for a serving of Greek yogurt of 170 grams, you will get 187 milligrams of calcium. So I've just put that in there as a reference for you. So if you're eating a serving of sardines, you will get 325 milligrams of calcium, and a lot of the dark leafy green vegetables such as collard greens and spinach and kale and bok choy will also give you quite a lot of calcium, so between 160 and 266 milligrams per cup. Dried figs and chia seeds and sesame seeds and baked beans are also other great sources of calcium on a dairy-free diet. So let's now move on and talk about the low FODMAP diet and the challenge test. So the low FODMAP diet is an awesome tool that I use a lot with my clients, and initially I'm just going to talk about the reasons that you might want to trial the low FODMAP diet, because it's not right for everybody, but it can be miraculous really for other people. So to begin with, I want to talk about the symptoms that you might have that would indicate that you could do really well on the low FODMAP diet. So this is just my list of symptoms for poor gut health, and I will be referring to this in the next module around gut health. But I want to point out a few particular symptoms that I use to show or indicate whether someone should try the low FODMAP diet. So definitely if you've got symptoms of poor gut health, such as bloating and belching and flatulence after meals, nausea, indigestion, reflux, diarrhea or constipation, if you've got those symptoms, I definitely think you should trial the low FODMAP diet. But also if you have brain fog or fatigue, as well as yeast infections, vaginal yeast infections or urinary tract infections, frequently that is, and also sinusitis. So I use these symptoms as a gauge of whether someone should use the low FODMAP diet. So you may have a lot of brain fog but no digestive complaints. I would still use the low FODMAP diet, especially if you have the immune problems. So if you don't have any of these symptoms right now, I think you should just stop this video and move on to the next section of this module, because I don't think the low FODMAP diet would help your mood at all. So I wanted to give you an example of this, and this is a client of mine who came to see me, and she was 30 years of age and she was on a leave of absence at the time from her job because she had such severe brain fog. So when she was at work and they'd talk about what job she needed to do, what tasks she needed to do, she would go from that discussion and go and sit down at her computer, and by the time she'd sat down at her computer, she'd forgotten what her task was. So her doctor had diagnosed her with depression, but she had felt that this didn't really fit her symptom picture, that she wasn't depressed. She had real fatigue and brain fog. I noticed from her history that she was also plagued with ongoing UTIs or urinary tract infections, and she had also had a lot of vaginal yeast infections too. And so at our first consult, I said, I think you should trial the low FODMAP diet. And 5 days later, she rang me up on the phone. Now, a lot of people will send me an email when they're doing well, but she was so over the moon that she rang me and she said, I've been on this low FODMAP diet, and within this 5 days, my brain fog has cleared up and I'm not fatigued anymore. It's like a miracle. And so the low FODMAP diet for the right people can be a miracle. So let's talk about what the low FODMAP diet is. So it's a diet created by the Monash University, and they've used it to treat irritable bowel syndrome. So FODMAP is an acronym for a group of short-chain carbohydrates and sugar alcohols that are found in the diet, and I'll discuss what that acronym is in a couple of slides' time. But on the low FODMAP diet, you eat foods that are low in FODMAPs and you avoid high FODMAP foods. Now let me tell you that it's not a long-term diet, okay? It's really used for short term, so probably 6 months at a time, but it's great for reducing symptoms, okay? And those are the symptoms that I've talked about before. So gut health issues, diarrhea and constipation. I've had another client that within 3 days her diarrhea stopped when she went on the low FODMAP diet. So it really is great. But also, as I said, the brain fog and the fatigue, it can be great for this. So what happens when you eat FODMAP foods, foods that are high in FODMAPs? Well, FODMAPs are rapidly fermented by the bacteria living in your intestines, and they pull more water into your gut, and they produce a lot of gases. And the gases can result in a lot of bloating and distension and digestive pain. But these gases don't just stay in the digestive tract, but they can get into the bloodstream and get into the brain, and that's when you can have a lot of brain fog. And the gas can also, through the bloodstream, affect your muscles and give you muscle pain as well. Now, the gas in the water can also contribute to diarrhea or constipation as well. So people without irritable bowel syndrome or IBS, or without bacterial imbalances in the gut, are typically able to ingest FODMAPs without concern. So that's why the FODMAP diet is only really for people with gut issues, and as I said, the brain fog, fatigue issues as well. So what does the FODMAP acronym stand for? Well, F stands for fermentable, so giving off gases. The bacteria ferment the food and give off gases. O stands for oligosaccharides, and that includes fructans and galacto-oligosaccharides, which are found in grains, vegetables and legumes. D stands for disaccharides, like lactose, which is found in dairy. M stands for monosaccharides, which is fructose found in fruit, and AP stands for and polyols, which includes sorbitol and mannitol found in fruit, vegetables and artificial sweeteners as well. Now please realize that I've created a resource for you called the Low FODMAP Diet document, and in here you'll have an introduction about what the low FODMAP diet is, a list of foods that you can eat and foods that you should avoid, and then it also goes on into the challenge test, which I'll be talking about in a few moments as well. Another resource that you could use is a smartphone app. Now the Monash University have one, but there's also a lot of other ones that are free. And the good thing about having all this information on your smartphone app is when you're at a restaurant or someone else's house or in the supermarket and you're not sure what foods are low FODMAP and which foods are high FODMAP, you can just look that up on your phone. Okay, so what you should do is strictly follow the low FODMAP diet for 4 weeks. Okay, only eat foods that are low on the low FODMAP list, and avoid all moderate and high FODMAP foods. Now, during this time, I want you to monitor your symptoms. Maybe in the first week or 2, you might not be very good, and you'll eat foods that are high in FODMAPs without realizing. But so that's normal. That's why I suggest you do it for a full 4 weeks, because by the time you get to week 3 and 4, you'll know what you're doing. Okay. But what I want you to do is print out the diary that is in the low FODMAP resource, and I want you to monitor your symptoms. So monitor your digestive complaints, your brain fog, your fatigue and anxiety, as well as sinusitis, UTIs and yeast infections as well. What I didn't say is that the low FODMAP diet can be also helpful for anxiety too. So if after these 4 weeks you've had some improvements, I want you to go on and do the challenge test phase, okay, which we'll talk about now. But if you haven't had any improvements, go back on to a gluten-free diet with or without dairy, and I've given you the guidelines on whether you should include dairy or not in the last module. So now let's talk about the challenge test. And the purpose of the challenge test is to find out which FODMAP categories you tolerate and which ones you don't. Because you don't want to be on the low FODMAP diet for life, because it is reasonably restrictive. But you want to see which low FODMAPs you tolerate and which ones you don't, so that then you can go on and incorporate the other low FODMAP categories that you do actually tolerate. So over a 5-week period, you test your tolerance to polyols, to lactose, to fructose, to fructans and galactans. And here's the diary for you. So what you do is on a Monday, Wednesday and Friday each week, you introduce one FODMAP food category, okay? And on week 1, as I said, you test the polyols, which is you can use half a cup of mushrooms and 4 dried apricots to test your tolerance to polyols. So on Monday you eat those, and if you had no problems with that, then you would repeat them and eat them again on the Wednesday, and if you have no symptoms flaring up, you would eat them again on the Friday. Now on week 2 you would introduce the lactose just for that 1 week, and you would trial either 1 cup of milk or 200 grams of unsweetened, unflavored yogurt. Okay. Week number 3, when you test fructose, you can use 2 teaspoons of honey to test that. For week 4 with the fructans, you can use 2 slices of wholemeal bread. So this is not gluten-free bread, this is just standard wholemeal bread. And week number 5, you test the galactans using half a cup of lentils or legumes. So here's just a few notes about the challenge test, and please pay particular attention to the next couple of slides about how to do this challenge test accurately. So what you want to do is monitor your symptoms for 48 hours after each dose of the FODMAP to determine if there is any possible reactions to that FODMAP category. Make sure you use the diet and the symptom diary, and if you have no symptoms on the Monday, carry on and have the next dose on the Wednesday, and if you have no problems on the Wednesday, go on and eat more on the Friday. But if you experience a worsening of symptoms at any stage, then just discontinue the trial of that specific FODMAP food and wait until symptoms resolve. Once the symptoms have resolved, move on to the next type of FODMAP category to trial. So if during the challenge test you discover you tolerate a specific FODMAP food, do not add it back into your diet yet, okay? So on week number 2, you might find that, hey, I'm fine with lactose and I don't react to it. Please, please, please don't add that back into your diet until the whole of the 5-week challenge test has been completed, okay? Only add in the FODMAP category that you are testing during that 1 week, okay? Because small doses of individual FODMAPs may have an additive effect and it may make the challenge test difficult to interpret. Okay, so at the end of the 5 weeks challenge test, you would have finished all the five FODMAP categories and seen whether you tolerated them or not. So you have a list of those FODMAPs you tolerate and a list of those FODMAPs that you don't tolerate. So you can, after the challenge test is finished, you can add those ones that you have tolerated back into your diet. So then your diet is not as restrictive as it was. Okay. Avoid those specific FODMAP categories that you do not tolerate well, and my suggestion is that you work on your gut health in the meantime. Because if the low FODMAP diet has helped your mental health, then it's showing that you have a problem with the bacterial balance in your gut. And so you need to pay particular attention to your gut health and really watch and follow the guidelines in the gut health module that we'll be talking about next. Okay. So remember the low FODMAP diet resources. You've got the document that gives you a list of the low FODMAP foods that you can eat and the ones that you need to avoid, and also the challenge test in that document. Alternatively, you can use a smartphone app such as the Monash University FODMAP app. So hopefully you found that interesting, and I really suggest that you give the low FODMAP diet a trial if you've got poor gut health or you're suffering from brain fog or fatigue. But next, let's just talk about managing food sensitivities and ensuring that you're not on a diet that's very, very restrictive. So in this section, I just want to give you a few guidelines about managing your food sensitivities, because what I find is that when you talk about different food sensitivities like your blood sugars and going gluten-free and dairy-free and the low FODMAP diet, people try to do everything at once, and that can be quite difficult and very restrictive and not what I recommend. So I just want to give a few guidelines in this section. Now, I apologize if it is a little bit repetitive, but I just wanted to take all of the ambiguity out of it and all of the confusion out of it. So don't try to follow every diet at once. Either use a low FODMAP diet or a gluten-free and dairy-free diet, or just a gluten-free diet on its own. Okay, so for many people, a low gluten or a low dairy or lactose-free diet can be enough to make a difference. Okay, so you don't have to do everything. But just keep in mind, for anyone with celiac disease, that you need to follow a very strict gluten-free diet, so no contaminants. Okay, but you may need to go dairy-free or follow the low FODMAP diet for a time to help heal the gut, especially if you're an adult and you haven't been diagnosed with celiac disease until adulthood. You may need to put some work into healing the gut lining. The second suggestion is if you have digestive issues, brain fog, sinusitis, frequent UTIs, or frequent yeast infections, trial the low FODMAP diet for 4 weeks. After strictly following the diet, if you do not have any improvements, go back onto a gluten-free diet or a gluten-free and dairy-free diet. If after strictly following the diet you do have improvements, go on and do the challenge test. Okay, just a note, the low FODMAP diet is low gluten, but it is not strictly gluten-free. And many gluten-free products are not low FODMAP. Don't confuse the two. A low FODMAP diet is lactose-free, but it's not dairy-free. So anyone with depression, anxiety, or chronic fatigue that is not on a low FODMAP diet should definitely be on a gluten-free diet to lower inflammation of the brain. Add in dairy or remove dairy, so go dairy free or be lactose free if you have symptoms of dairy intolerance. So again, this is a bit repetitive, but just to spell it out. If you're diagnosed with celiac disease, follow a strict gluten-free diet. If you have digestive issues, brain fog, sinusitis, frequent UTIs, or frequent yeast infections, trial the low FODMAP diet. And anyone with depression, anxiety, or chronic fatigue that is not on a low FODMAP diet, they should follow a gluten-free diet. And if your symptoms and history suggest, also have a dairy-free diet. So let's move on and talk about the aims that you can consider for this module. So removing particular foods out of your diet can be very helpful for your energy levels, for stabilizing mood and reducing anxiety. So firstly, to help with unbalanced blood sugars, reducing sugar in your diet is a really great first step, and trialing some healthy sweet alternatives. Remember that I've given you a slide on sweet alternatives, and also in the Real Relief Real Food Planner, there are some meal ideas there too. Also, following that plate planner recommendation from module number 2 is going to be helpful for balancing blood sugars. So aim to include protein and fat with every meal, because this can stabilize your blood sugars. You may just want to consider improving one meal at a time. I don't want this to be overwhelming for you. Yes, we are covering all this information in 6 weeks, but you don't have to make all those changes in 6 weeks, just little by little. So maybe think about your breakfast. If your breakfast is no good, if you know, eating cereal for breakfast every morning, get some protein into your breakfast. So it could be eggs or an omelette, or it could be a protein smoothie, or some Greek yogurt if you tolerate dairy. Also, to help balance unbalanced blood sugars and anxiety, consider chromium, alpha-lipoic acid, or CoQ10 supplements. So this is helpful for anyone with sugar cravings and anyone that has reactive hypoglycemia, and you may have anxiety related to that. So also get your celiac disease blood test performed, and just check your results to make sure that you don't have celiac disease. As well as balancing blood sugars, now you want to decide whether you want to remove any particular foods out of your diet. So if you just want to go gluten-free, or gluten-free and dairy-free, or finally the low FODMAP diet. So if you start with the low FODMAP diet, if you've got digestive complaints and you've got brain fog or fatigue issues, or urinary tract infections, trial the low FODMAP diet and do that for 4 weeks, and do it very strictly, okay? So only eat the foods that are low in FODMAPs for those 4 weeks. So you can either download the low FODMAP diet information that I've created for you from the bonus section, or use the Monash University FODMAP app. If you get symptom relief during those 4 weeks, go on and do the challenge test. But if you have no symptom relief, go back onto a gluten-free diet and possibly a dairy-free diet too. So I hope you go well with those aims for this week, and I'll see you in the next module.